is used in the case where you have a nulliparous patient. Is it clear? So when you are going to use it, you can see the cervix inside. Is it clear? You can see fluid draining out from the internal os of the cervix. Is it clear? And then you ask her to cough. You cough, she cough with the mouth open. The Valsalva maneuver is actually cough it's actually coughing with the mouth closed, coughing with the mouth closed, such as to increase the intra-abdominal pressure, such that the intergonal pressure pushes the fluid outside for it to be visualized from the lower genital tract, and that's the fluid is going to be visualized coming out from the cervix. Is it clear? So that is how you're going to visualize the disease from your physical examination. Now, the next element that you have to evaluate, you must also evaluate for the cause. Is it clear? You must evaluate for the cause, and generally we say that the cause in the case of a premature rupture of membrane can be either be associated with a cervical incompetence, a cervical insufficiency, or associated with an increase in intra-abdominal pressure, intrauterine pressure. In order to visualize the increase in intrauterine pressure, you can either have the sinusoidal height. You take in the history or your ANC history, you go and look for the usual sinusoidal height of the mother. If the sinusoidal height is greater than the gestational age, normally you need to know that what the gestational age is approximately equal to a sinusoidal height plus or minus 2 weeks of gestation, provided that the sinusoidal height is below the umbilicus, and the gestational age is approximately equal to sinusoidal height plus or minus 4 weeks of gestation, provided that the sinusoidal height is above the fundus, is above the umbilicus. Is it clear? So those are the different elements. So in this case, you try to visualize if it corresponds to the sinusoidal height, and if you have a sinusoidal height which is larger for the gestational age in the past ANCs, it means that she could have that risk factor. Is it clear? And also from her past ANC, you must also visualize for the ultrasound that she did in her past ANC, and she may tell you that they told her that the baby was big. In the case of a macrosomic baby, you may also visualize that she has a multiple gestation, or you may also visualize that she was having a polyhydramnios. Is it clear? So all those are elements that you can have from her past history from ANC by asking questions to investigate for etiology. Also from the etiology, she could tell you that as from 32 weeks of gestation, because normal recommendation asks that in the ANC as from 32 weeks of gestation, you are supposed to do from 32 weeks of gestation, you are supposed to do a cervical swab and culture, or mucosal swab and culture. Is it in order to detect for the group B Streptococcus microorganism, Is it? She may tell you that at that 32 weeks of gestation, she was diagnosed positive for the group B Streptococcus, and this may tell you the reason why she may have that cervicitis. Is it? Or she may also tell you that in her review of systems, she usually have a leukorrhea which is offensive, and that is different from a gravidic hydorrhea which is whitish but it is non-offensive. Is it clear? But if she tells you that she has a leukorrhea which is yellowish, not whitish, or it is offensive and whitish, it means that it is an infectious process, and that is the etiology of cervicitis. If she tells you that she has painful dyspareunia, painful sexual intercourse, that's dyspareunia on deep penetration, that also tells you that she has cervicitis. And another element on the physical examination which can tell you that the cervicitis is that you go at the level of the cervix, you are going to see a grape-like presentation. The cervix is going to be reddish. Is it clear? And you may see grape-like presentation which may tell you that there is an infectious process. Is it clear? Grape-like presentation at the level of the cervix telling you that there is an infectious process, particularly Trichomonas vaginalis. Is it clear? So all those elements can tell you. You can also do a cervical motion examination with the chandelier, where you are going to visualize the chandelier's sign, where the woman is going to tilt her pelvis away from the examining bed when you are doing a cervical motion. Is it clear? She's going to have cervical motion tenderness. So all these are elements that can tell you that there's a infectious process on the cervix. Is it clear? And this can help you to visualize the etiology of the premature rupture of membrane. Now, after visualizing the etiology of premature rupture of membrane, we now need to also visualize from your history and physical examination the complication of premature rupture of membrane. Is it clear? So for this, you need to know, to ask yourself, what are the complications of premature rupture of membrane by knowing the pathophysiology of premature rupture of membrane. Thank you.